Hello, everybody. I am Chelsea Whittington, and I am pleased to have a conversation today in the name of mental health awareness in the month of May. I am here with Mrs. Teshezia George of Edgewater Health. Please introduce yourself fully and give us your title with this amazing organization.
Hi, yes, hello everyone. My name is Teshezia George and I'm the Director of Family and Youth here at Edgewater Health.
Director of Family and Youth. That is a very critical program. And anytime I think about youth, mental health services, I feel encouraged in that it is slowly not becoming that taboo topic about youth and their mental health. It used to be a time where if a young person was having a problem, we were like, shake it off, you'll be all right. But we are starting to recognize that. Talk about your role and exactly how you impact young people through Edgewater Health.
Yes, definitely. My role here is to make sure that we provide integrated care services here through Family and Youth. And we do that by, we have several programs here. One of our outpatient services, we have several clinicians that provide psychotherapy individually and through family services. We want to reach the whole family.
Yes.
Because of course, a lot of the issues that the young people are experiencing today stems from environments at home.
Yes.
So those are the things that you see happening at school. They may come to school upset, and it could be even something simple as they're not eating breakfast, or just some things that are occurring, dynamics within the home as far as with their mom. It could be a step parent. It could even be with their siblings, or just other things that they haven't even discussed, or don't even know how it impacts them. It could be grief, different things like that.
Yes.
So what we do is we ensure that they receive those services, like I said, on an individual basis or through family services. Then we have several other programs. One of them is our day treatment program, which is our program for students who are having a tough time staying in their regular homeschool environment.
I see.
So what we do there is we receive referrals from the schools. We work with several different school districts, Hammond, East Chicago, and Gary Community School Corporation. And those students come here for 5 hours of their day. They receive therapeutic services, which may include individual psychotherapy. And we do 2 groups a day with them. And that is to work with them with their emotional regulation. They receive a trauma-informed and evidence-based group in the first part of the day, which is through cognitive behavioral intervention and trauma curriculum. And then the second group, which is in the afternoon, they receive ADL skills, just like managing stress, managing anxiety.
That is so good. I mean, and that's a lot to take in, but I'm just so encouraged when I hear these things, because if you just think about when we were growing up, versus the environment that they grow up in now, as far as the noise, if you will, that they have from social media, trying to get this buy-in from others that I need this amount of likes, I need this amount of attention, or if I'm being berated online, I'm being bullied online, so many different circumstances that we didn't have to think about because the technology didn't exist. And so how do you get the young people to come to get this help? Is it a parent? Is it a referral? Do we go out and recruit? How does that work?
Yes, definitely. So with the day treatment, a lot of those referrals, we do get some parent referrals, but most of those referrals come from the schools.
Okay.
From the outpatient services, those could be a number of things. It could be referrals from parents, it can be a guardian, it can be a school referral. Because of course, youth do not refer themselves.
Right.
So of course, anybody can do referrals. And then we also do go out into the community and make sure that people know about our services.
Yes.
I didn't mention our other program, which is our home-based program, which is our wraparound facilitators that go out and they network with DCS and they network with Lake County Juvenile Justice judges and case managers, because that program is designed to keep our young, especially our young minorities, out of jail.
Oh, love it.
Out of the Lake County Juvenile Justice System.
Preventive measures.
Preventive measures. So we go into those homes and we provide therapy, mentoring, tutoring, And we kind of find out what they like.
Yes.
Because sometimes we found that maybe they are not being encouraged at home. They may want to be a airline pilot, and they don't know how to get there. They don't know where to start because they're already going through a cycle of what they learned at home. So our job as that facilitator is to push them into the Civil Air Patrol or teach them about other things. So when we go out and network, we push all of these different things. But we speak with the Gary YMCA. We talk about how we can get some of their
the YW?
I'm sorry,
YWCA, but the YMCA is coming, so we'll have both.
Exactly, that's what I'm thinking. I'm thinking ahead.
Yes, I love that. We need all of these organizations
Exactly.
and resources that are targeted towards youth, whether it be Boys and Girls Club, YWCA, YMCA, and so many others.
Exactly.
I have to ask you, how long have you been in this field and with Edgewater, and what made you be drawn to this type of program?
Yes, well, I have been in this field for 26 years.
Oh my, you are seasoned.
I am seasoned. And I just came back to Edgewater. This is my second stint.
Second stint, I love it.
Yes, and mainly because, for one, I love my community. I love making a difference as far as helping youth and families because this service is needed. There's always been a stigma on mental health, and our job here is to make sure we take away that stigma because a lot of people don't understand that it's needed. These services are needed, especially after COVID. That's when we saw a lot of those heightened behaviors that occurred when when the youth, we all were placed into the homes.
It was a shift for everybody.
Exactly. Everybody was challenged. So a lot of people saw that they needed more. They needed service. I won't say more. They needed services. Those that didn't even receive services needed services. So when I decided to come back here, it was because I wanted to stay in my community. I wanted to continue to serve in this type of capacity and give back and make sure that individuals receive these type of services.
Well, we are so glad to have you. We're chatting with Mrs. George over here at Edgewater Health in the name of Mental Health Awareness Month. There was another idea that came to my head when you talk about young people and the preventive measures. I'm still thinking about law enforcement. I'm thinking about how they interface with law enforcement, their thoughts about it prior to, having the interface, what they think about police. Are there programs or tips in place that we share with the young people about maybe what their mental state is and working when they encounter law enforcement?
Well, we haven't quite got that far yet.
Okay.
So that is something that we will do in the future.
Yes.
Because our young people, especially with our day treatment, there's been a few occasions where they have had to interact with the police, and we don't want them to interact with them in a negative fashion.
Yes.
Because of course the state of affairs in our country right now, we want them to understand that they are, it can impact them in a much serious way. So that is a plan going forward to help them see that all law enforcement is not bad, but how do we react?
Yes, how do we handle ourselves? And I want to give credit to law enforcement agencies, ours in this area included, in getting the training they need to interact with those who may be encountering some mental difficulties that some circumstances I'm sure you've seen on the news have gone really badly. As a result of them not having the background information when interacting, whether it's an adult or a child, that this is a mental health situation and it has to be different than a criminal situation sometimes when someone is acting out. What else do you want to see for the program moving forward? Now that you're in your second stint, I'm sure you have your hands on kind of building it out. Are there other plans in place that you want to see?
Yes, I would love to. So we haven't done a residential component in a while. I would love to see us do something, but more towards those that are graduating out of high school that still don't have
that young adult population.
Yeah, the young adult population. I know that there was some talks in the past with the Gary Housing Authority.
Okay. That would be a great partnership.
That would be a great partnership.
Perhaps this video plants the seed.
Exactly.
I love
so
it.
I would love to have some talks around that. Because I know we have our Phoenix House, we have a few other programs, and it has all ages there, but we need something more around that 18, 19 population, just for them, because a lot of times they still don't have all the necessary skills, and they don't need to be put in a situation where they're with much older individuals.
Yes, they need that different demographic
Exactly.
that caters and speaks to them.
Exactly.
So if people want to get in touch with you
Yes.
to learn more about your program and go online, how do they do that?
Yes, they can give us a call here at Edgewater Health at 219-885-4264, or they can reach me directly at 219-806-3589. They're my direct phone line.
Wonderful. So let's talk a little bit before we get out of here about Mental Health Awareness Month. You working in an environment with lots of mental health professionals and you in your field. What do you want people to know about their mental health, and what advice would you give them as far as just things that will help us to
Yes.
take care of ourselves mentally?
There is nothing wrong with getting help. Mental health awareness is very important for yourself, for your families. It is not back in the day where everyone would say that you're crazy. People don't realize that job could be stressful. Different individuals have issues with money, financial, gambling. There's different reasons that or different things that can impact you. It can even be one of your children is having a tough time and you can't navigate the situation on your own. And the most important thing to remember is you can't give to other people if your cup is not full.
Oh, so true.
So you have to make sure that you're in a mental mind state, and you can't be a parent. You can't be an effective parent, because let's speak on that youth component. You can't be an effective parent if you're not yourself, and it's okay to get help.
I'm so glad you said that, because a lot of times, again, we're still trying to get over that stigma, that taboo about therapy and mental health. But again, I really like that part about being full to be able to give to others. Are there any things that you do in particular that keep you? Because I know it's hard not to take your work home with you.
It is.
Mentally. And when you see others going through their various challenges, what do you do to ensure that you're not bringing that into your mental
Yes,
fold?
definitely, because we all go through challenges, and even as a provider here, I go through my own challenges, and my family goes through challenges as well. I'm helping my daughter through some things, and so what I do, and anybody who sees me at the store, don't take it personally. Sundays are my self-care quiet time, so when I go shopping, that is my me time.
Yes.
So I may go get my nails done, go to the mall, go to the grocery store. That's how I get my time away from everybody at home. And sometimes I'll cut my phone off or just cut it on vibrate.
Yes.
Just to get some quiet time, because phones will continue to go off.
Yes, they will.
So my friends know, don't take it personally.
Right.
So sometimes, you just have to disconnect from the world, but that's what I do. I just disconnect, even if it's just for 4 hours, 5 hours, but that's how I get my mental balance and recharge time, because once I go back home, it's back to the hustle and bustle of cooking
And being
mom,
super wife, super mom, all of those
grandma,
things.
everything. So yes, all of those things.
Well, I have just been overjoyed and fulfilled in chatting with you. I'm so glad that you are on your second stint with Edgewater Health. Teshezia George, please give your contact information one more time before we get out of here.
Yes, 219-806-3589.
Everybody, please make sure you follow Edgewater Health. It is Mental Health Awareness Month. And remember, self-care is the best care. Take care of that mental. Thanks so much for watching, and please share this video. We will see you next time.